Okay, so now I'm going to show you a treatment for someone with Bell's palsy. So Lacey obviously doesn't have Bell's palsy. It happens when the cranial nerve 7 gets compressed, and so you lose sensation in one half of your face, and you lose motor control, so it goes flaccid, so it looks like one half of your face is drooping. You've seen people like this. This is a common thing that happens. About 85% of cases get better within a few weeks. um, it's a pretty prevalent thing. So in this case, we're going to say that this side of Lacey's face is all flaccid and droopy. Clearly it's not, but we're going to say it is. Okay. So in this case, I would work on the neck a little bit and warm up, get her used to my touch, get her comfortable. And then I'm going to take the muscles on this side of the face that are like hypertonic, I'm going to just move towards the center line of her face and sort of just smooth those muscles out a little bit to drop their tone. So I'm moving towards the center line and pushing the tissue in this way. I'm just doing some real light neuromuscular techniques to drop the tone in her face on this side. And because this side of her face has got to be tired from overcompensating. And then on this side of her face, when I'm done dropping the tone and all of these muscles here, I'm going to work on the muscles up into her temple, or temporalis muscles. And on this side, I'm going to just do some light tapping. So the idea is to get this muscle here stimulated. A little pince small and some light tapping to try and get this muscle to contract because it's flaccid and it doesn't contract. So that's the kind of techniques I would do. And I would ask Lacey if she can raise her eyebrows for me. And I might help her with the side that's paralyzed. Can you raise your eyebrows? Up. Okay. Again. And I'm just going to help her with the side that's paralyzed so she can get used to those muscles again, recruitment again. And I might do this with her maybe 10 times. And then I'm going to go down and I'm going to get Lacey to flare her nostrils.
How?
You know how to flare your nostrils, where you go, yeah, like you're breathing.
I just breathe?
Yeah. And I'm just going to help the muscle on the paralyzed side to be able to perform the action. And you can do these at home too. You just help yourself perform the action. And eventually this side will start doing it too. Okay, now I'm going to get you to smile. So I'm going to help with this side to bring your muscles up so that you're able to smile with both sides of your face. And this also helps to retrain the muscles for the right action. So that kind of stuff, it's going to help your brain, connection between your brain and the muscles that you're using to sort of build that connection so that your muscles don't, do something different than what you're asking them to, as they can sometimes. So that's all I would do, is I would work on that, drop in that tone, work on those exercises. I could try a little pincement if she was able to smile and she wasn't quite able to do it, but she didn't need me to push her lip up. I could just do a little bit of pincement while she tries to engage that muscle, and it might allow her to contract the muscle. And yeah, I would do some fluid work up in here, up in just in front of the auditory meatus. I would do some work in there where there's, because that's where the nerve goes through that's been pinched. So I would do a little work in there, maybe pump the cervical terminus to allow the fluid to drain away. And I would do that like 30 times. And then I would work on just decreasing any swelling in this area. I might put a little bit of cold hydrotherapy on if it's particularly sore or irritable. And I would just do some lymphatic drainage work there and try to remove some of the fluid in that area. And I might finish up with a little neck work and the head again. And that would be it.